Hi, this is Mary Rubino, and the show is Naturally Speaking. This is the next episode. Our last episode was with Eileen Kelly Valladini, and she was an energy healer. But today we have Nick Julian and Mark Mazzucchelli, and they're both chiropractors here out in Franklin, and they have a lot to offer people in the holistic realm on how to feel better, especially through injuries. So, Nick, if you could just tell us a little bit about your practice and
about my practice?
Yes.
It's actually our practice now, but about 33 years ago this year, I started practicing chiropractic first in Milford, Massachusetts, with a gentleman by the name of Nunzio Bonina, and many people from this area might remember him because he was quite a character. Practiced with him for only about 3 months, and then started searching out in Franklin for additional office space where I could start my own practice. And kind of a little funny story, I was walking downtown with my dad, just looking around downtown in Franklin, and we met Officer Nick D'Angelo, and we asked Nick if he knew if there was any place for rent right downtown. He brought me to Dr. Pastorello's old office, and while we were there, he introduced me to Dr. Pastorello, and that day I rented the office. We stayed in that office for 26 years.
Wow.
It was right on Route 140 in Franklin, across from the old Zoetrope Theater. Some of us will remember that.
I remember that.
You remember it? It's not there any longer, but the building is still there. And we practiced chiropractic there for most of my career, just recently moving to the opposite end of Franklin by the Stop and Shop Plaza.
Oh, nice.
Over those years, if I might, I practiced primarily a family practice, and that's why I'm really excited to have Dr. Mazzucchelli here now, because Dr. Mazzucchelli, though he does family practice, also has specialties in sports and other types of care that I generally don't do.
Well, that makes it for a nice blend. Dr. Mazzucchelli, tell me a little bit about yourself now, because you're new to the practice,
Right.
but
I'm a
you're gonna
fairly
be
new chiropractor in the business too. I went to school in Hopkinton, Massachusetts, high school. There I wrestled, and that's when I kind of got into the medical health care type of field. I got a couple injuries myself, like sprained strains, and I actually broke my forearm in multiple places, 2 ACLs.
Wow.
So that's what kind of got me into the health kind of field. So after in college, I decided I wanted to be a chiropractor. I went to a couple of them. They helped me out. And from then, I just went to a chiropractic college in Florida.
Okay.
But the school's originally in National. It's called National University of Health Sciences in Chicago. So I got my chiropractic degree back in 2014. Then I went to Natick, where the chiropractor there was a sports chiropractor. Okay. So he actually went an extra 3 years for sports medicine and those type of related injuries. And he taught me a lot more than what I learned in school about those type of injuries and how to manage them.
Okay. So your specialty basically is with sports medicine?
Yeah, I didn't want to get into it, but it kind of just fell. I kind of did, but I just fell into it the way it went.
That's kind of how it happens sometimes. You know, you start out on a path, and sometimes things find you,
Right.
and that's a good thing. That's a great thing, and you guys make a great combination at the office. I've been in there quite a few times. That's where I work as well, and I found that it's nice to have people with different backgrounds and different histories when it comes to stuff like this.
Exactly.
Because you have something to bring to the table, and of course Dr. Nick does as well, more traditional perhaps, and maybe a couple of new things. I saw at the office the taping, the rock tape, which tell us a little bit about this rock tape.
So the rock tape, it's a stretchy type of tape. You can stretch it about like 50% of what it, like compared to white tape, that white athletic tape that you normally used to wrap ankles to make them non-mobile.
Right.
So this tape actually, you can have some flexibility with it. So it's not restricting type of tape. The tape's job is basically it's almost like when you hit shin against a table and you go to rub it.
Oh, and it feels better when
feels
you do
better.
that, yeah.
So the tape is trying to take advantage of that type of reaction that you feel, the effects of that, by picking up the skin on the top of your proprioceptors in the skin,
Okay.
which you can relate back to your brain quicker than pain receptors.
Oh, okay.
So basically, it kind of turns down the pain that you perceive to your brain by picking up the skin and irritating those receptors to turn down the total pain to your brain.
Well, that should be very helpful, especially for anyone doing
Right.
sports. I've seen it on TV, and I always wondered why are these people taped up, and it kind of looks, don't mind me, but it kind of looks a little like duct tape too. And
There's
so-
all different types of colors.
Yeah. Now, you had told me a great story about how this all started with the horse. Can you tell that story
Oh
today?
yeah. So when I was in school, I learned about this when they brought out the tape, and the way the tape came about, it was with horse racing. So one of the trainers noticed the horse was limping, and it was going around the corral with the horse. And he noticed if he put his hand on the hind of the horse where it was limping, the horse stopped limping. So he goes, let me try something else, and he put a layer of duct tape on that area, and the duct tape held, and it made the horse stop limping when it was trotting around, and there it goes. And now we put it on humans.
Yeah, but not duct tape.
Not duct tape. It's specialized, stretchy tape type of tape. So.
That's excellent. I love that story, and I want to have you say that.
And
too.
it's not only for pain or sprained ankles. You can use it for tendonitis. Because another application of it, because it's so stretchy, it picks up the skin, so you can get more blood flow to the muscles and take out bad type of like tissue and damage, like lymph, out of the area, so you can get more facilitated healing in that area.
So that allows it to heal better.
Heal-
Tendonitis is huge. A lot of people have that. A lot of people have that. And Dr. Nick, what are the other things that you've been helping people with? I know I've come to you quite a few times with my neck, but
For many different things. And I might just add, just bringing up the horse.
great
piece.
story.
Chiropractic, by the way,
do
we
horses,
treat
yeah.
horses all the time. Well, I don't, but there are very specialty
Specialized.
chiropractors that treat horses, dogs, cats, any kind of animal. And it's been very helpful and very effective for the years. So that might be somebody you might want to talk about.
I might have to meet a horse chiropractor or animal
That's
chiropractor.
it. That's
yes.
it. Chiropractic for me has always been about the family and establishing a relationship with people and their family members that move on with time. So it's not unusual that some of my patients that come into the practice today have been patients of mine for 30 years or 33 years, and they've not only brought in their husbands, wives, and mothers and fathers, but their children's children are now coming in to see us as well. I am generally just a very old traditional chiropractor. You come into the office, we do a full examination, and we find out where the issue is, and then through a series of manipulations, either to your neck, middle back, low back, or actually any joint in the body, we help the body to feel better and to help itself reach its potential for activity in life. So that's why chiropractic is really, what it does is it gets down to the nervous system of the body, and through affecting the nervous system, it allows your body to express itself more healthily.
That's excellent explanation on that. And I can see where people would come, an entire family, because once you feel good, you want to share that with people.
It's true.
Yeah.
It's true. And you know, the funny thing about it is some people have always heard that, gee, once you start going to a chiropractor, you go to them for life. That's true. You do. You go to us for life, but you go to your dentist for life. You go to your primary care physician for life. It's not every day or every other week or whatever, but you do. You want to keep your spine, which is multifaceted and moves all over the place. You want to make sure that it's doing what it's supposed to do throughout your life.
Yeah, it's amazing all the different things that are out there that help people maintain their body and their health. Now, if you don't take care of your spine, or you hurt a part of your body and you don't get it treated, it can have some really long-term effects on you.
Yeah, it
correct?
snowballs those effects, right?
Yeah, just so much. And when people get hurt here, I'm sure people get hurt at the high school, and they need some help with that. So the taping and stuff like that can help be preventative too, correct?
Right, correct.
Yeah. So that's an excellent thing. So tell me about the future of your practice, because you've got a great combination here.
Right.
Well, the future is to build the practice as it is now. after a little while, I'm going to kind of start taking a little step back here or there. Dr. Mark will certainly build a sports injury practice, but in addition, he is very interested in family practice as well, and will hopefully just maintain the practice as it was. Not going anywhere fast here. I'm still kind of young, but in the future, we hope that Franklin Back and Joint Care will be here for another 30 or 40 years with Dr. Mark behind the helm. But right now, we're both working together.
That's excellent. It's such a good offering, you know, to see you both. And I want to just relate a little bit of a story myself. I've come to Dr. Nick for neck and back and different issues, but the very last time I came, I got a very different experience because you came and checked my blood pressure.
Yes.
And I've never had that done before in a chiropractic setting. So it was like a really full care, and I had high blood pressure, which I wasn't aware of. So there's a lot that goes on with your body, and I'm sure that blood pressure can go high with pain, but you know, it's great to raise awareness to different things. And so when you come to you, both of you give me a very good feeling of total care that way.
Yep.
So what do you see the most of? Is there like a particular thing you both work on people for a lot? I mean, some kind of preventative step someone could take?
Yeah, a lot of it's muscle imbalances you will see. People that say, oh, my knee hurts, but it's the whole chain that's affected. Your glutes, your TFL, all the way down to your ankle, it's all affected. Most of the allopathic doctors, they don't really take account with that. They don't really see that. They rather treat the acute symptoms of it, and not really go down and look at different muscle imbalances and get your hands in there and check the different muscles, test the different muscles, the strength of the muscles.
No, that's totally very powerful. I mean, in holistic, there's a whole body thing, and you can't just treat symptoms. You know, there's always a core issue that needs to be addressed to create that healing throughout the body.
Right.
And I think being able to do that and get to the meat and potatoes of it is really important. So
by far, the thing that we see mostly in our practice is people coming in with back pain.
Back pain.
They do come in with neck pain, with middle back pain, shoulder pain, headaches, a number of different ailments, but by far it's primarily back pain that first gets them into the office. And then as we're treating, we don't just treat the joints, we treat the muscles, the ligaments, the tendons. And because we know so much about each patient that comes in or person that comes in, we can help them with a lot of other issues as well. Not necessarily medical issues, but we've been around long enough to know quite a number of physicians in the area that we can make direct referrals to if necessary. So it's by far associated with spinal back pain, neck pain, that most people come in to see us for initially, but it can run the gamut from toe pain, foot pain, ankle pain, all of the above. It's usually pain first.
Well, that's what drives it,
It
right?
drives it,
exactly.
yes.
And the muscle imbalances could cause a joint restriction as well. And then you get the back pain, or vice versa. The back, you could have injured your back, and then your muscles would be all unbalanced.
Yeah, and you can feel it. Like sometimes people get a pain in their back that moves down your leg, and it really creates an enormous amount of problem when it's the back that needs to be cared for, correct?
Correct.
Yeah, so being able to identify the issue right off the bat and then treat it and get in there, I think that's what really people look for. They don't really want to have symptom relief. They want to have a whole body experience and be able to heal and feel better. It's like, you know, you go to the car, you know, you bring your car for an oil change, you want them to look at everything. You don't want them to just change your oil and send you on your way, right? And then getting that maintenance is so important.
Right.
It's incredibly important.
Initially, I think what drives people in is discomfort and pain. But you know, we've grown up in a system of healthcare where if it's not broke, don't fix it, kind of thing. And we've always you know, had wonderful television shows, you know, Doc Marcus Welby, MD, and things of that sort. That I think we've never had a Dr. Julian chiropractor television show. So for the most part, people don't know what chiropractic does. But they do know if your back hurts, I can go in to see a chiropractor and probably get help from it. And it's from that point that it's our job to
Right.
really educate folks as to what else chiropractic can be and to what else they can do to make themselves much healthier.
Oh yeah, and I've walked in. Of course, I've been in the office many, many times,
Yeah.
and you have a lot of information, lot of handouts about the spine and the parts of your body that are connected to that, and how much relief actually occurs once you just make a simple adjustment. Well, maybe not simple because you obviously have to know what you're doing.
Yep.
So that's huge as well. Now, one of the things that was new to me was reading about how you can help headaches, and that's one of the things I've come to you guys for is headache relief.
Yes.
And that's created by a bunch of different things, correct? I mean, you have to kind of know someone's lifestyle, and then
There are many
you know.
different kinds of headaches. There's muscle tension headaches, there's sinus headaches, there's migraine headaches, and in that category of headaches, there are all sorts of different migrainous types of headaches, cluster headaches and things of that sort as well. So finding the ultimate root of the issue is important, and that frequently isn't very easy to do because many folks come in with a combination
oh, right.
of different types of headaches. So for that piece that maybe is musculoskeletal or muscle tension headaches, they get a lot of relief from that, but still have issues with other sorts of headaches that we have to look further into. So yes, chiropractic can be very effective for headaches on all levels, especially when we do the muscular work that's associated with it, not just the joint work with manipulation.
So a lot of headaches, the tension ones too. The people who are on the computers all day typing with their heads forward and an anterior tilt, and that's puts a lot of stress on the back side of your suboccipital muscles. And
It's called tech neck.
Tech neck,
It
really?
is, yeah.
I can
Yes.
imagine a lot of
Yeah.
people would have issues with
Tons
that.
nowadays.
And then you get people who are in the phone,
Absolutely.
and they're almost
Same
like
thing,
in that
yeah.
position all the time,
Absolutely.
like this,
Yes.
you know?
Yes.
Yeah, I can see how that could happen easily.
Yeah.
Now, you have to be kind of a detective a little bit when people come to you because it may be something out of the ordinary that you have to tap into. I know when I came with my headaches, it was from lifting too much weight at the gym, and I wasn't really connecting that. I felt like there was a strain, but so there's a lot
Or
of
it could
things,
be
right?
a little bit more sinister. You don't know what's underneath on the bones. Yet that's why we do such a thorough exam to take a look and account for that, like malignancies, tumors, and stuff like that can be causing the same symptoms of just a muscle type of problem.
Well, that'd be
or
important.
a joint problem.
Yeah, that'd be very important.
So that's why we have
tap
to take
into.
such a thorough exam when we first see someone.
So now, when someone comes into you, maybe it is just a headache or something like that, or you think it's something as simple as a headache, and then you start to go throughout the body, part by part. You can tap into those tensions in other areas, right?
Yes.
Just by feeling, or
Yeah, it's called motion palpation. So we go along your spine, we motion palpate it, basically looking for places where the joints should move, but they're stiff and restricted.
Oh.
You don't have that give sensation like a normal joint does, or the other joints above and below. So that's how we figure out where the problem spots are. And then on the muscles too, we look for trigger points and stuff like that.
that's fascinating.
Yep.
I never knew that. That's really amazing. Because people think, oh, I just go and get my back cracked, but
Right.
it's so much more than that. So
There-
much more.
There's quite a bit of art and there's quite a bit of technique all involved. But it's a personal type of healthcare. It's one where the better the relationship between you and your chiropractor, the better things are going to work. It's when we first meet you, we want to find out all about you. What you eat. How often do you sleep? Do you sleep well? Do you sleep poorly? Do you have to use 3 or 4 different pillows? Do you exercise? How much exercise do you get? Most of the problems that we deal with are lifestyle issues.
Exactly.
So knowing exactly what your issues are during the day and where you've been and your past history, so there's a lot of give and take, not just the physical adjustive parts and working on the muscle parts, but getting to know you and getting to know what motivates you and what doesn't, and your past history is very important for us to know.
I would imagine that people that have anxiety and stress are deeply affected in their body.
Oh yeah, especially in the upper back. And
Upper
they're
back.
always hiking up their shoulders, and it's gotta tell them just to relax.
You don't need that though, Mary. You're super
That's
smooth.
right.
You're cool.
I try, but
Yeah.
you know, a lot of that is centered in your it does react. Your body does react a lot to your thoughts and to you
Emotion.
know, yeah, any kind of emotion like that. So now you also have Mandy in your office, and she does massage.
Yes.
So that's a great benefit as well. Now, do you, when you go through the body, like you're saying, you're feeling for the stress points, and you're trying to see, is there any give? And you'd want to have that, but if
Right.
you didn't, the muscle relaxation through massage would help as well, correct?
Of course,
Yeah,
yeah,
yeah.
definitely. I do another type of technique. It's like ART. So when I do find those tight trigger points in there, it's almost like a active type of trigger point massage, if you want to call it like that. And basically, what I do is I put the muscle back into extension. And then I will pin the muscle belly down where that trigger point is, where that myofascial lesion is. That
Okay. I'm
tight
trying
knot,
to imagine this in my
that
mind.
tight
Okay.
knot. So I get it and I pin it. So as you go through a range of motion, that knot rolls over my finger and it becomes broken up. And you do it a couple times, and
Does that hurt?
It's not comfortable.
Hurts good.
It hurts
It's
good.
a good
You
hurt.
feel relief later, right?
does.
So that's
It
just like
hurts.
breaking up a muscle.
Breaking up those myofascial lesions, the scar tissue that forms in that muscle belly.
It's a little bit different from traditional massage.
Okay.
But Mandy has been working with us in our office for quite a number of years now, and chiropractic and massage are like brothers and sisters. They go well together.
Yes.
They help the chiropractor to be able to affect more manipulative process to the spine, and it helps with the muscles to relax. But what we found in many years of practice is that there's not only one thing that's going to get the job done, but a number of different techniques and a number of different approaches that usually gets the best results.
Yeah.
Yeah.
I'm going to put a little plug in for myself because I work at your office too.
You do indeed.
Doing hypnosis.
And I was about to say that hypnosis is another positive factor that can help people to get healthier quicker and maintain their health easier over a longer period of time.
Yeah. Well, yeah. I mean, I've seen a lot of times when people may have come to me with, thoughts and things that are holding them back, but they may also have things that they haven't given attention to in their bodies. So they're feeling the tension and they're more angry about it than looking for the solution. They're not quite sure what they can do. Right. So it really is, that's one of the reasons for the show, is to bring awareness and bring attention to all the things that are out here in this area that can help people.
The brain is a marvelous piece of equipment, and you don't always have to medicate it to get healthy. And I think that the shows just like this are what our community needs to just open their minds to the possibility of something a little bit different than what they've experienced for most of their life.
This is true. It's very true. And there's so much out in this area that is effective and that does help. And I want to make sure that I mention that there's no one size fits all when it comes to this stuff.
True.
But that being said, that chiropractic, if you could just come in there and have an exam and just find out, there may be one little thing that needs to be tweaked to help you feel better and have more energy.
Right.
So, try to be, for people to try to be more open and receptive to it. I know the very first time I went to a chiropractor, it wasn't common for people to go. I mean, it probably was a good 30, 35 years ago. I had hurt my neck and pulled I had what do you call that, like a muscle pull in my neck.
Yep.
And people normally would wear collars and immobilize it, but
No, you don't want to do that.
you
nowadays.
don't want to do that. It does not
It
help.
makes it worse.
Right. It was a pinched nerve. That's what it was. I had to think about that for a minute. It was a long time ago.
Sure.
Yeah.
Yeah, a long time ago too. Massachusetts was one of the last states in the union to license chiropractors. So I can understand that. 30, 35 years ago was about when I started.
Yeah,
my
exactly.
practice. And so yes, it's been a long road to get more people to understand that chiropractic should be on the table for everybody.
Exactly.
It's not a cure-all, obviously, but it can certainly be helpful for everybody, all ages, by
Right.
the way.
Well, I mean, if your body's not working in perfect alignment, you're going to feel that in all different ways. It could express itself differently for different people, but still, it's so important. And you guys do a great job. You really do. I love coming to the office and just learning more. I've spent a lot of time reading about that rock tape because it was so new to me.
Yeah.
And I think if people are just more open in their mind towards anything that will help you, I mean, just open it up and just, give it a try. Chiropractic has been around for a long time. Way back, it was kind of considered a voodoo because people didn't understand it. But now it's just so common for people to treat all different things with that. And, like last week we had Eden Energy, and that was very new to me. I hadn't learned about that until then. And people are learning there's just so much more than just going to a doctor with a symptom, give me a pill or whatever. There's so much more people can do to empower themselves, help themselves with this.
That's important. It's self-empowerment, taking responsibility for your own health and doing what you need to move forward. Pills are important for a lot of people and a lot of different problems, but they're not always the best way to go, and it's not always necessary to medicate.
Right.
So have an open mind and a mind that's a little bit more educated on a day-to-day basis by shows like this.
Yeah. Oh, thank you. That's important. It is important. I mean, I think that a lot of times people don't understand, and that's what may hold you back. So, check out our show next week as well. And I want to thank you guys both for coming in.
It was a pleasure.
Oh, absolute pleasure. And I want to have you come back again as well, okay?
Yeah,
All
definitely.
right. So thank you very much. This is
problem.
Mary Rubino with Naturally Speaking. And tune in next time for our next episode. Thank you.